Each year in the United States, there are over 1 million visits to healthcare providers and more than 300,000 ER visits for kidney stone problems. We went to Valley Presbyterian Hospital in the San Fernando Valley and spoke to Doctor Adam Ramin, who has information on the treatments for kidney stones.
Kidney stone is essentially a stone that forms inside the kidney. It's usually formed as urine is being produced in the kidney. Certain types of concretions occur inside the urine, and it initially forms into what's called a matrix, and on top of the matrix, more calcium and more uric acid can build up, finally forming a real stone. The most common symptoms of kidney stone is pain located in the flank area. Severely painful, and it's associated with nausea, vomiting. It's a sharp stabbing pain, sometimes it's a cramping pain. And as the stone starts moving down towards the bladder, the pain can start radiating towards the groin area. So if it starts up here, it'll feel like a band of pain going down this way. It doesn't take a very large stone to cause a tremendous amount of pain.
Sharon, Washington, a patient of Dr. Adam Ramin, tells her story.
My side was just hurting. My right side was hurting, my lower right side. And they told me that I had a kidney stone and that it would bypass. And it never bypassed, and that pain just got worse and worse and worse before I got a hold to this wonderful doctor that I have now. And then he took care of the problem. It's a pain that I wouldn't wish on no one to have, no one.
Treatment of kidney stones includes trial of passage, meaning allowing the stone to pass by itself. It could also include lithotripsy, which is either a procedure where you lay on a machine and sound waves are sent into the kidney to fracture the stone, or a ureteroscopy, where we go with a small camera up into the body where a person urinates, go all the way up into the ureter and the kidney and laser the stone. Or if we have a very large stone, occasionally we have to go from back here, make a hole into the skin and into the kidney, look inside the kidney directly, and use an ultrasonic device, which is kind of like a jackhammer, to break the stone into small pieces and suction them out. And occasionally a stent is also placed because the procedure that has been done causes swelling of the kidney and the ureter, thereby blocking the ureter, not letting things pass through. So the stent allows opening of the ureter again for passage.
How can someone prevent kidney stones from forming?
Prevention of kidney stones usually starts with diet, and it can extend into medical therapy as well. But the easiest way to prevent kidney stones is to drink plenty of fluids. However, when we have a patient with kidney stones, we normally do a stone analysis, and we also collect their urine to see what is wrong inside the urine. Is the calcium too high? Is the oxalate too high? Uric acid too high? Based on finding out what the metabolites are that are abnormal inside the urine, then we can modify a person's diet. So for instance, patients who put out too much oxalates in their urine, we ask them not to eat as much broccoli or spinach, stay away from chocolate, stay away from colas, teas, those kinds of things. People who have high uric acid levels, getting uric acid stones, we modify their red meat intake, their protein intake to reduce uric acid formation in the urine. Beyond diet control, then there are medications that can be used as well to prevent kidney stone formation.
Dr. Ramin gives some advice on kidney stones.
It's very important that a person who has a kidney stone be treated at a center with specialized equipment. Successful treatment of kidney stone occurs in centers of excellence that have the right lithotripters, that have the right scopes, right laser devices, and obviously experienced surgeons who know how to treat kidney stones. With that, it's a much higher chance that with one treatment, a person will be completely stone-free.